Hello everybody. I had to redo this part of the video. I had left some things out and I wanted to make sure that I had everything that I know as far as the incontinence medical supplies. So I'm sure you all have seen the caption, all right, the title. So this is for those of you who need incontinent medical supplies because you've been buying them over the counter and they are expensive. I got to remember to focus on this side because I don't know which side the camera is on. I'm always flipping my camera. All right, so you all know also from my page that my name is Ann, all right, and I've been a registered nurse this year. It makes 25 years, and I am going to possibly be retiring out. No more. Okay, I'm moving on to different things. That doesn't mean that I'm going to stop my channel, though. I'm going to start bringing new things to my channel. But I'm not going to stop with the savings, okay? Because we all need those savings. All right, let's get into this. Please pay attention to this part because this is the most necessary thing that you will need, okay? All right, and if you have a senior in your home, or elderly, even in your family, or even someone who's disabled, and just know you don't have to be senior to be disabled, okay? Please share this. I never ask you guys to just share everything. You may see other things that say share, but you never actually heard me say to share this video. Share this video to someone who may need it because this is important. And just remember, we're going to start with this. This is not Medicare. It is Medicaid, AID. So the public aid in your state pays for incontinence supplies. All right. I love the video that I had done before. I did save that part, and you will see exactly what medical supplies that I have that they will cover. No, you cannot just walk up to a medical supply company and say, I need these supplies. It doesn't work that way. You must, first of all, be over the age of 4. That's how young you can be. All right? And you have to be a Medicaid recipient. You have to already be a Medicaid recipient because you get assigned a Medicaid number that will be used to buy your supplies with, okay? Because they do pay the state for these supplies. All right, now this is the part you need to pay attention to. You have to have, must have, there's no way around this, either a signed certificate of medical necessity within the last 6 months that your medical supplies are necessary. It has to be within the last 6 months, okay? Or you have to have a prescription from your healthcare provider, i.e. physician, doctor, okay? You must have a prescription. This is the route that I am 100% used to because I made sure that my patients who had already had medical issues, okay? This is usually from some type of medical issue as you get older, especially those of you who may be dealing with patients who have Alzheimer's or dementia, as sometimes they forget to use the bathroom. Or you may have people who have had complicated issues with kidneys or their bladders who can no longer hold their urine. Now, this is bowel and bladder. It's not just for urine, okay, because they do have diapers, just in case some of you have a family member who have loose stools. If you have spinal cord injuries, okay, meaning especially if you are a para, okay, from the waist down, or you can be from the neck down. But you have to have no control over your bowel or bladder. That is what incontinent means, okay? no control, or as we can say, no voluntary control at all of your bowel and bladder. All right, the natural aging process, you may have to buy a lighter or something to use. I'm not speaking of that. That is your natural aging process. I am speaking about those who have had some type of traumatic or even at birth injury that they cannot hold their bowel or bladder. All right, so this is the part that there were some things that I left out, which was the 4 years of age or older, and I left out the part that you need to have a signed certificate of medical necessity within 6 months. All right, now what you're going to see is the rest of the video that I had already done. Okay, I'm going to attach it to this. I took the first part out, and in that video when I went over it, I noticed that every now and then I slipped and said you're going to buy. You're not going to buy anything. Just remember that. Just say purchase or request. Just think purchase or request. You're not going to buy. All right, so once you go to your doctor, you have a discussion with your doctor. Please don't ask me what to do. I don't know your history. I don't do that. This is a discussion between you and your physician. You should have a very trusted relationship with your nurse and or physician. Okay, you have to discuss this. I know sometimes it may be uncomfortable because we are talking bowel and bladder. Okay, but it is necessary. It is necessary, especially if you are a Medicaid recipient, but you're going into these stores and you're buying these high-priced items. Now, I know there are channels that tell you, oh, you can get this free, you can get that free. You have to jump through hoops, and you already are dealing or having, you're challenged already with trying to deal with what's going on in your own home. Then to be out here trying to clip coupons, running on deals, doing rebates, apps and all. Medicaid. If your loved one has Medicaid, all you need is that prescription from your doctor. Contact a medical supply company. Ask them if they accept the prescription and Medicaid for medical supplies. The majority of them do. It's a money game out here. Okay, the majority of them do. They will ask for that information and they want the prescription. They in turn will call your physician's office to verify. So don't be out here writing stuff, stealing prescriptions. Okay, prescription pads. All right, they will call your physician, who in turn will verify everything, and then the medical supply company takes it from there. Now here in Illinois, it's every 2 months. They will call, ask if you need any supplies. You will tell them what you need, all except gloves. They do not supply gloves, and that is the biggest thing we need, right? And mask. They do not supply mask. Okay, so they will call in 2 months. They will ask if you need any supplies. You will tell them what you need, and then they will call you back for your delivery time and date. It is usually between 8 and 12 or 1 and 5. As you can see, I'm used to this. And trust me, they will knock on your door and you will have boxes delivered to your door. You don't have to worry about buying a diaper, buying, I call them pull-ups. I have everything coming to actually show you. You don't have to buy liners, okay, or underpads. The underpads, if you can think of those pads that you buy when you're training, say you train a puppy, you know, they call them puppy pads. It looks like that. We call them Chucks, C-H-U-X. And they're very large and they cover your bed so that they can protect your sheets and your mattresses. Those things are available to you free of charge because Medicaid will pay for them. All right. I know I'd never looked at any of the a channel from a medical supply company that tries to get you to buy something, but take it from me, I am somebody who has been in the homes okay, who have helped my patients receive these items, and it was a big money saver for them, and they were able to take the money that they were buying for those items and to put them elsewhere, okay, that was needed for the home. One thing you should not have to worry about are diapers, pads, liners, and underpads for the bed. All right, so with that being said, I hope this was helpful. Always make sure that your Medicaid is up to date. Okay, don't get caught with it having expired or saying that you have to come in and do it over again. Once again, it starts with your doctor. Everything goes back to your physician, and it has to be a medical necessity, and it has to have a prescription. I know I'm saying it over and over again, but believe me, somebody would be, is that like what they give you when you need medicine? Yes. Those little pads or paper, because I know they print them out now, that they write your medication on so you can take it to the pharmacy. That's what you need. All right. And I hope I clarified everything. And stay tuned, because now you will see exactly what they cover. All right. Be blessed, guys. Any questions, put them below. I will have this video to where it's not public as far as your questions, those things. Now remember, if I say go to your physician, go to your physician. All right. But basic questions that you may have, I will answer. All right. Talk to you later. Bye-bye. You are done. Okay. You will be hearing back from the medical supply company. Now, how it works is once that process is done, they will let you know when the supplies come and how often they come. You don't even have to call them. Trust me. They're trying to get their money. They'll be calling you. Do you need any more supplies? Okay. And as far as I know, because I was asking questions, they do not cover gloves. You will have to buy your own gloves. Okay, because that was a big thing. So you will have to buy your own gloves. But let me show you exactly what they will cover. All right, I tried to get most of everything that I know of. Now, this is for those of you who are still active or still can move around. And it is also for those who are bedridden, meaning you can't sit up, get up, sit in the chair, walk, or anything like that. You literally are in bed, okay? Let's start with the basic bladder. Now, in the stores, if you can think of the pens, this is in a separate aisle from the Kotex and the Always, okay? This is in a totally different aisle. You usually will find these around the medical supplies. If you know where the canes, the walkers, and things of that nature, if you study, you know, if you walk down that aisle, you will see supplies like this. If you see something called Depend, okay, this is just a sample, as you can see. It comes, you know, for male and female. Oh, and the products are unisex, okay. But in the stores, the Depends, you'll see a male, and then you'll see a female, okay. And those are the underwear. Now, this is the Depend brand, okay. This is the Depend brand. These are the whole full coverage. It's called a pull-up. A lot of times people don't want to, if you're still moving around and you're able to walk around and things of that nature, you're still active, you don't want to wear a diaper, okay? You don't want to wear a diaper. So what you can wear is, if you can think of the toddlers who are being potty trained, you know, pull-ups, this is what it reminds you of, except it's underwear. We call them the pull-ups, okay? Pull-ups for short. But they are underwear. All right, you will wear these instead of instead of, your briefs, or ladies, your panties. Okay, you wear this. Okay, now this is the package that you'll get. Now, this brand in Illinois is Prevail. Okay, Prevail is the brand that you'll use. And as you can see, those are the pull-ups. Okay. This is how it looks. Does it look familiar? It looks very similar, right? Okay, so let's do it side by side. These are your Depends. These are your pull-ups. Okay, or your underwear. Prevail, I'll say that. These are Depends. These are Prevails. This is over the counter in the store. This is what you will get through Medicaid. Free to you. Free of charge to you. The medical supply company. Medicaid will pay the medical supply company. All right. Now, some of you may say, yeah, but it depends. Maybe they'll hold urine, a lot more urine. If you are one to have a lot of issues, what you will do is you can purchase, can you see that? There it is. Liners. Okay. Now, some of you may not be up to the point where you need to wear a Depend, a liner, underwear. I'm sorry, I'm getting confused here. You may not want to wear underwear. You may still be able to wear your own underwear. You may only want the liner. Okay. This is the liner. I should have left it out so you guys can see, but let me do this. You can hear me pulling it out now. But put in mind of a sanitary napkin. That's what it looks like. These are the liners, and they're very, very thick. Okay, they're very thick. You will use this on your underwear, and you can wear this during the day. Okay? Now, however, if you have no control at all and you urinate heavily, okay, let's say you drink a lot of water and things, you can actually wear this. You will place this on the inside of this. And yes, you can order both. You can order both. And now you have even more coverage. Okay, you won't have to worry about leakage or anything of that nature. And sometimes some people who are still able to move around, they wear this to bed as well with the liner on the inside, just in case something may happen overnight and you don't want any accidents. Okay, so I keep looking over there, but I think the camera is over here. So we are done with this part. Let's move on to, now, if you don't need that many liners, they can come in smaller packages like this. Okay, that depends on how many you want or need. You can actually split it up, split your order up. Say I need some liners, I need some Depends, I keep saying Depends. I need some liners and I need some underwear. And I also need a pad. Say you are bedridden, and sometimes, those of you who have family members who are bedridden and they have absolutely no control and they just go bowel and bladder, okay, you can actually also buy liners for your bed. Hold on one second. Okay, I had to run out to get, I knew it was something I kept looking over here. These are, let's see, let's get the underpads. You see that there? Think of puppy pads. You know how you have to buy the pads to train your puppies? Puppy pads. Now, in the hospitals, if you're older like me, and one of the old school nurses used to call them chucks. Okay, chucks used to be cloth, but then they went to plastic. This is what you can line your bed with. Okay, as you can see, look at here, start here. That is how long they are, okay? And then we're going to go up. They're very, very large. So this side will go on the mattress side or the bed sheet side to protect your bed sheet. And this side, of course, catches the urine or the bowel. Okay, because sometimes patients do have loose stools, especially if you are, if the patient is a tube feeder. You know, a lot of times they don't have solid bowels; they tend to have runny bowels. So you will use this. You will use this, and a diaper. Everybody's familiar with the diapers, especially if you work in the nursing homes. I've never worked in I think I did a 2-week stint in a nursing home. I couldn't do it. I was always fussing at something. Well, I wasn't fussing, but I'm very strict. So it was a little too much for me. Okay, but these are the diapers. Now this is a large. This is a large. You see how big that is? These diapers have the Velcro tabs. Okay, and the Velcro tabs. And this is the inside of the diapers. And this is actually a good marker that lets you know where you can put. I'm going to use it again in case you have a patient or a family member. I'll say family member because this is for those of you who have family members at home that you're taking care of. Okay, you see that marker? Let's see if we can do it again. You see that marker there? That is where you will put the liner. Okay, and this will give you extra protection at night. So when you wake up in the morning, you won't have your bed messed up and have to wash your linen and everything. So I think that's everything I went over everything. These are just the supplies that they do cover. Medicaid does cover this, okay? I should know because I help a family member with this. Every 2 months, there is a knock at the door and there are boxes. You will see boxes. You don't have to do anything, okay? Now, remember you have the pads. Let me just show you the bag instead of this. This is a larger package because they are the diapers. So the diapers are larger. They are called breezers. Prevail breezers. Those are the diapers. Okay, so we have that one. We have the underpads. These are called underpads. Or you could just say underpads for the bed. That's what I usually say, underpads for the bed. Okay, and you know what you can do with these as well? You can put these on your on the wheelchair. If a patient sits in a wheelchair or if they sit up in a chair, you can line your chair with these to protect your chair, your furniture. You have the now this is called the daily underwear. All right, or pull-ups. And you have your your liners, as you can see there. For bladder leaks, you see that? Daily pads, okay? And again, if you don't need that many, it will come in a smaller package, all right? So I think that's everything there, okay? So if you have any questions, just put them below. I don't make my comments public, so don't feel bad if you have a question, or and you don't feel like you can't ask a question. Nobody will see it. That's the way I have it set up. I will set this video up. I'll put it that way. I will set up this video so that all comments are not public and that I can see them and read them. Now, into what I can do is, if I get quite a bit of questions, because in order to answer them, I have to make it public, and I don't want to do that because I know your name is attached to the top. So if I will wait about a week after the video goes up, and then I will do another video, and then I will actually say the question that was asked, and give you the best answer that I can. I am that nurse that says, if I don't know, I don't know, but I will get back to you. And if I try to research it or make some phone calls and I could find anything out, I will let you know that as well. Okay? But as always, your first bet is to always have a conversation with your doctor, because I don't know your condition. I don't know your history. I don't know your lab work. I have not seen any testings that were done on you, and I don't want to know. Please go to your doctor, keep everything confined in together, and make it a habit of trying to have a conversation with your doctor. If you feel, as a matter of fact, if you are not that comfortable speaking to your doctor, okay, you should always be comfortable having any and all types of conversation with your physician without feeling as if you're going to be talked about or your confidentiality is going to be breached, okay, in any kind of way. So have the conversation, all right? And if you have never spoken about it to your doctor, now is the time to do it, okay? Especially if you have Medicaid. I cannot stress this enough. You all do not know how many homes I've been into, and people were literally like broke, because they were trying to buy all of these supplies. This would take a huge load off of a family member who need this information. And this is not only just towards seniors, okay, because as you know, there are even younger people who are on Medicaid who are disabled and need these supplies. The same will apply to you. There's no age limitation or anything like that on getting these supplies, especially if it's through Medicaid. It will have to go through approval anyway, okay? Why not try it, okay? If you don't, you'll never know. So just have the conversation, get your diagnosis of incontinence of bowel and bladder, contact a medical supply company. You can get that information just by Google, medical supply companies near me. Call them, ask them if they accept Medicaid, and if so, do they deliver? And 3, I have a diagnosis. I even have a script. What else do I need to do? They will walk you through it. It's money. They will walk you through everything. Let's just be honest. They're getting paid. They want money. They'll walk you through it, okay? All right. I hope this helped you guys on today. I really did. And once again, I apologize for being so late with the video. I just wanted to make sure that I had enough supplies so that I can show you all at one time exactly what they pay for. Just remember, don't ask for gloves. They ain't paying for no gloves. Gloves are very expensive, and everybody needs gloves, okay? They're not paying for gloves. Okay. And that's about it. All right, so God bless you guys. I hope this was an informative video for you all. And once again, if you have any questions, put them below. And after a week, I'm not taking any more questions after about a week, because I'm pretty sure if you watch the video, of all of the answers, I would have answered your question already. I am in the state of Illinois. If your state does it differently, then that's your state. My state, that's what they do. All right. God bless. Happy Valentine's Day. Today is February 14th. The year is 2024. All right. Peace, love, and happiness. Bye-bye.